Michigan has developed a statewide initiative that has become a model for other states in the U.S. The Michigan Antibiotic Resistance Reduction Coalition, or MARR, is a grassroots organization consisting of public and private interests.
I was reading a medical journal and I came across an article about antibiotic resistance and how prevalent it was. This article happened to be about resistance in children who had an overuse of antibiotics. And I noticed that my former chief of medicine, Merle Sandy, was one of the authors. So I called up Merle and I said, "Hey, Merle, I got a great idea. You did this study and it was just in a medical center, but if you did it with us, you'd have access to data all across Michigan and even more." And he got excited.
In 1997, General Motors, out of concern about healthcare costs for its employees, instituted its Save 100 program to improve healthcare and reduce its costs.
The MARR approach, which involves community education as well, and that's one.
I was thrilled when I was asked by then Dean of the School of Medicine at Wayne State, Dr. Robert Sokol, to begin a program focusing on reduction of excessive antibiotic usage in the community.
One of the first things that we developed was the Antibiotics in You educational brochure, and we targeted parents of young children because they tended to be big users of antibiotics for things like ear infections and typical childhood illnesses. We developed the brochure for that purpose, and then that evolved into a school education program targeted at children from grades 3 to 5 called Antibiotics in You. And that brought about the development of the Resistance Ranger and some of the characters that are now so familiar with MARR.
I remember back in 2003, I was at the CDC and I was running the Get Smart program, Know When Antibiotics Work. And at our annual conference, bringing in programs from around the country, we honored MARR for the work that you were doing and the program that you had constructed called Antibiotics in You. 3 years later, MARR was one of the leaders in a project that we put together, the Antibiotic Roundup, which taught people how they could bring unused antibiotics into their pharmacies to have them destroyed in a safe way.
The Michigan Department of Health and Human Services partnership with MARR is important because MARR can provide that direct community outreach, the boots on the ground that often the state can't provide. So whether it's the school-age education or the programs for community education or resources for dental offices, MARR's message on antibiotics and their appropriate use needs to resonate in multiple settings, and we're happy to partner and reach partners across the state.
Congratulations and thank you to the MARR Coalition for 25 years of hard work and successful efforts to help reduce antibiotic resistance and preserve our antibiotics lifeline.
My involvement with MARR began back in 2005 when Mary Shaw decided to pitch her idea to the Wayne State University College of Pharmacy to have pharmacy students actually become MARR ambassadors and deliver MARR's message to elementary school students throughout Southeast Michigan. The program expanded by collaborating with all 3 colleges in the state of Michigan. Many of them reached out to their own elementary schools.
Hello, I am Simran and I am a MARR antibiotic ambassador. I have enjoyed sharing the MARR hand hygiene and antibiotic resources with my school and community.
On behalf of our office, I want to congratulate MARR on 25 years of excellence in improving antibiotic use and addressing the threat of antibiotic resistance. You have achieved great heights, reaching 30,000 feet and spreading your message to airline passengers.
To learn more, visit the MARR Coalition, mi-marr.org.
My talk began with familiar words plagiarized from one of the most eloquent of our presidents. The world will little note, nor long remember what I say here, but it can never forget what happened today. I made it through the presentation, knowing that few in the audience really cared about new antibiotics at that time.
MARR partnered with Michigan State Medical Society to deliver a program. It was titled Truth with Satisfaction. This program addressed the overuse of antibiotics for viral upper respiratory tract infections. We wanted the clinicians to see they could engender trust and patient satisfaction while still adhering to the science of using antibiotics only for bacterial infections. This, along with other tools of the initiative, turned the tide of overprescribing antibiotics for simple colds and coughs of viral etiology.
We have been just so glad to work with MARR over the past few years. We've collaborated with them on U.S. Antibiotic Awareness Week. Elaine has presented at our summits to help us raise awareness of antibiotic stewardship, antimicrobial resistance, and their relationships to C. diff. MARR has been just a really wonderful partner and resource for Peggy Lillis Foundation.
I heard you were in pain. Tell me, what's going on?
My tooth hurts really bad. Now I can't chew on this side. I've had this happen before. I just need an antibiotic, right?
I am so grateful for so many of your team members. We've been collaborating over the last few years to move antibiotic stewardship and oral health forward. Since we started working together, we've made changes to resources that dentists can access chairside, and even developed some of our own resources to help dentists and all dental health team members participate chairside in practicing antibiotic stewardship.
As I promote responsible antibiotic prescribing in dentistry, I want to mention the collaboration between MARR, OSAP, and the Centers for Disease Control and Prevention.
It is extremely gratifying to know that the important work of this organization continues to raise awareness about the essential need to use life-saving antibiotics wisely and appropriately. And I commend you for this work.
As the current executive director, I'm humbled by the support of the board of directors who have collectively contributed 117 years to the organization. Added to this are the countless hours of expertise volunteered by the members of the advisory council. The COVID pandemic created many challenges. We lost progress in combating antimicrobial resistance. Thankfully, during the pandemic, the contributions and hard work of MPH candidates from Wayne State University Public Health Sciences helped us to continue our work.
You may know that bacteria and viruses are two very different organisms.
Today, I'm going to highlight recent changes in how the antibiotics are used in the dental office.
Happy anniversary to MARR, 25 years, great accomplishments.
And I hope to continue MARR's mission of improving antimicrobial stewardship efforts in dental practice across South Florida.
So I just want to congratulate MARR on the huge milestones that you all have accomplished.
Thanks for having me, MARR. Happy anniversary, and here's to the next 25 years together.
I do think that the MARR organization was very innovative, and I'm so pleased that it's still going strong today.
Congratulations on 25 years. That's amazing. And we are looking forward to continuing to work with you in the future.
Congratulations on 25 years.
I want to congratulate you on this milestone achievement and wish you all the best over the next 25 years as you fight the fight.
Congratulations to MARR. I look forward to 25 more years to ensure the effectiveness of antibiotics for my grandchildren and future generations.